dermal filler has been down about 15 or 20% for the last 12 months. Interesting is biostimulators have been growing in the order of 200% a year. So many nurses tell us that they're part-time injector, part-time counsellor. The intimacy that is shared in that chair and in that room is real, and that is something not to be ignored in the context of healthcare. It's easier to get Botox in Mount Isa than it is to get perimenopause care. Like, how messed up is that? If you're in a consultation and you're treating someone with potentially poor skin integrity, there are certain things you can do with cosmetic injectables and medicines and creams, but maybe their skin has a poor appearance because of hormonal changes. The most commonly prescribed medicine for menopause and perimenopause is antidepressants, which don't help. It's a Band-Aid, but it's a Band-Aid put on the wrong place. So you've still got the wound there and you're wearing a Band-Aid. If we walk away from this as a slice of healthcare delivery, it's not going to be ignored. It's going to be taken up by technology professionals, marketing professionals. Someone's going to step into it. So step up.
Hey guys, welcome to another episode of Inside Aesthetics. If you're watching on YouTube or Spotify, you'll realise we're in a weird configuration again in our home studio. We've had to move because we've got a guest today. Who have we got, David?
We've got John Delaney, co-founder of Fresh Clinics, all the way from Wollongong. You've driven up from the other side of the city or the other side of Sydney this morning to join us?
Yeah, no effort is too much for you guys.
We feel honoured. No, this isn't your first rodeo with us.
No,
had you several times before. But today we're talking about something a little bit different that you guys have launched. I don't know how long it's been going. You'll fill us in, but it's called Fresh Health. First of all, let's just talk about Fresh Clinics to loop in our newer audience members, people in the States and other countries. What are Fresh Clinics and what do you guys do?
Yeah, thanks guys. Thanks for having me again. Always a pleasure to be here. So I'm co-founder along with my other co-founder, Dr John Delaney. We're both medical doctors, and Fresh Clinics is a B2B supplier to the med spa industry, the cosmetic clinic industry, that provides all of the various medical infrastructure services that a med spa or a clinic might need. Yep. And at a really fundamental level, that's the authority that a practitioner will need to treat a patient and to store restricted medicines on their premises. And in addition to that, then the wraparound medical services to make sure that that patient is safe. And we put all of that into a technology layer that enables effortless compliance to be just a background function of your business. So we like to take that on for the clinics. So that's really core to what we do.
Yeah. I think just taking a trip down memory lane for a moment, I remember that the first time I heard about your business model, I was sitting in one of my clinics in Sydney and Jake worked with me at that time. And for anyone that doesn't know, the laser clinics model was, I guess, the first the first business model to really disrupt this industry and take these treatments to the masses. And I was sitting there and Jake goes, I've got these couple of mates of mine I used to work at RPA with, and they're starting this model called Fresh. And I'm like, what's it all about? And he said, they're going to provide support and scripting for nurses. And I'm like, that's interesting. That could kind of shake things up a little bit. And it's kind of ironic that you guys disrupted the disruptors.
Yeah,
it's really interesting. I've just been watching that sort of that full circle of the industry move and watching this sort of evolution.
Yeah, if you follow kind of startup business stuff, it's the innovator's dilemma, isn't it? That LCA innovated, and then the new innovation that came along disrupted their model, and they were so entrenched in the way that they ran their businesses. But we owe a reasonable amount of our inception and then our success to what LCA did in the market in Australia, which was created this large chain side of the market, which then the opposite of that was all these independents. And the independent market, it was a poor place for competition for small businesses in the independent side of our market is for medical oversight, for complication management. Compete all you like on high street for customers, for patients. But at the back end, patients should be looked after in a non-competitive sense, and we can provide that in a scaled way, right? Like you don't need, as a smaller clinic, you don't need to worry about the business continuity or the expense of having medical directors that are dedicated just exclusively to your clinic. And so we enable that. In again, applying our technology to that, we enable that to happen. And through that, we've actually we're proud to be part of a network of independent healthcare practitioners that stretches all across the country and again across the US. And that leads us to then Fresh Health, because what happens in those clinics up until now is essentially procedural medicine, right? But then can you also do consultative medicine in that space? And what can you do in those beautiful spaces, those clinics that people have invested in that have a healthcare practitioner in there that can deliver care? But also then those patients need to be plugged into specialised expertise, complication management, so on and so on. So that's, and we'll get into a bit of that, but that's some of the thesis there.
Yeah. Before we jump into Fresh Health, because I'm looking forward to talking all about that, just keen to get your perspective on where are we in 2026? You know, we've had so much competition. You guys are in some ways responsible for how many providers that are out there now. You know, the industry's coming under some criticism in terms of, do we have too much growth? Are people out there, you know, starting up these businesses too quickly, perhaps not armed with the right skills? Are we going to see a consolidation? Is there a process of natural selection going on with a number of providers? So just keen to get your thoughts on where are we right now? Where do you think we're going? And how do you see the Fresh model overall supporting the industry as it moves into this next iteration of itself?
Yeah, I mean, you flatter me, David, by saying the Fresh model. Like we certainly, I think we had a stronger tech lens on what we produced than others, but you know, there's others who have done this sort of thing before, and you know, a shout out to McCurdy and the others that are around that have been pioneers in this space.
Sure.
But our rapid expansion was in part due to that unserviced need that the independent market had to consolidate medical supervision and access to training and so on and so on. They were a little bit underserved. Again, it was a bit of a reaction to LCA, which dominated the market so much. Then, as we grow, innovator's dilemma, right? Other people are trying to innovate. They see that and they say, well, that looks easy and good. It's not easy, I promise you. But it, you know, from the outside, you might think, well, maybe I'll start that up. And a few have, and good luck to them. Like, everyone's got their own offering in market. We're pretty confident, we're very confident that we can deliver best-in-market services and solutions to anyone who honestly shops around and has a look, and we encourage people to do so. We're very confident in our offering. Are there too many, and will some shut down? Possibly, probably. I think AI has transformed how hard it is to create the tech. Like, we've invested years and millions in making our tech. That's no longer, that same paradigm doesn't exist anymore. So how does that change things? Not sure. We certainly need to be leaning into and are leaning into how we can rapidly develop things in that new world. The fundamental thing, though, is you still need really great relationships with the nurses who are part of your injecting community. You still need to understand the industry. You need to understand the needs of the clinics that you serve. You need to have great reciprocal, respectful relationships with the pharmaceutical partners that you work with. That doesn't happen overnight, and that takes, you know, it takes a lot of effort, a lot of honesty, and a lot of integrity to build those relationships over time. So we're very confident in our continued focus on those things. We're not letting our attention waver from the key things that drive value for our members.
Yeah. Now, before we get into Fresh Health, just give us a picture of the aesthetic market and trends. Like, what are your customers saying, or your nurses? Are they busy? Are they not busy? What products are in? What's coming potentially?
Yeah, busy, not busy is a good question, and it varies, of course, from clinic to clinic and from place to place. But I think the general sentiment is that it's a bit of a hustle at the moment. It's a bit of a grind. There are a lot of macroeconomic headwinds, right? A lot of uncertainty around the future, and what gets cut from the budget in those sorts of times is often the luxuries, right? Now, we have seen in previous tighter economic times that neurotox remains reasonably resilient, whereas dermal filler usually gets hit the hardest. Interestingly, we've seen across our whole network flattening of the decline that dermal filler has been having for the last 12 months or so, even longer, right? 18 months. Probably been down about 15 or 20%.
Yeah.
That's flattened, we've seen. The other thing that we've seen that's quite interesting is biostimulators, because they've been growing off a low base, but it's been in the order of 200% a year.
Yeah.
And when I say biostimulators, it's that whole category of not quite a dermal filler, but does other things. And we recently interviewed someone who described it as the inflammation industry. It's sort of, you know, that sort of stuff, right? But that has recently surpassed dermal filler in volume through our network. So that's a really interesting pivot point potentially for the industry. Is that a trend that'll reverse? Is that the new normal?
Yep.
Hard to tell yet, but you know, we're interested in that.
Okay.
We're then complementing that with, you know, a lot of training, a lot of dedicated training on how do clinics, you know, optimize their offering for their patients in the face of, you know, new economic realities and also new patient preferences, and keeping up to date on that is a big part of what we try to offer.
Yeah. I guess why I asked is, did you guys introduce Fresh Health in response to maybe realizing that some aesthetic services are flattening, or Or was it just completely different motivation?
No, it wasn't. That wasn't the motivation. It's not insignificant in the motivation of people who join Fresh Health, in that it is a risk diversification mechanism for any business owner, right? It's another offering you can bring to your patients.
Yeah.
It's another way you can advertise to attract patients. It is governed by different regulatory frameworks, so you diversify your regulatory risk. So there's a lot of advantages from that perspective. But actually the inception was, my co-founder John and I launched in the US and did that with the naivety of founders, where you're like, well, how hard could this be? And it turns out it's pretty hard. But we went over to the US and got involved in the med spa industry over there, and realised very quickly that they call what we would call a cosmetic clinic in Australia is called a med spa in the US, and I just thought it was nomenclature, but it's actually significant. It's much more of a perimedicine destination, and it's much more of a I hesitate to use the wellness as a word because it's been a little polluted, but it is a health optimization destination, right? If you're a consumer patient, hybrid, and you have a demand-driven healthcare outcome that you're after, right? You want to look better, feel better, lift yourself above your baseline, or perhaps get back to baseline, but using proactive health measures, these places are where you go. And so that sort of seeded an idea in us that we've got these beautiful locations. Our network's 2,000 odd clinics, right, in Australia. That's a really large distributed network of healthcare facilities with dedicated healthcare professionals in each of those facilities. And the facilities themselves are lovely, right? They're places you want to visit and spend time in. And the patients who attend consultations within these spaces, they actually luxuriate in time with a healthcare professional. It's not in, out, let's solve your issue with a quick prescription and so on. And, I don't denigrate that practice of medicine at all. In fact, I was part of that for a long time. The view there is, well, you've got this as a resource, you've got this as a delivery mechanism for healthcare. What else can be done in that? And what's the overlap between the patients who come in for aesthetic treatments and the other healthcare needs that they might need and might wish to pay for to receive them in a timely and private setting?
Yeah. You spoke about economic headwinds, and I'm talking to people every day. Some people are still doing great. They're just as busy as they've ever been. Some people, their business has just fallen through the floor. Mm-hmm. They're sort of clutching at straws in terms of what they need to do to resurrect or to support their business from a financial perspective. So they're reaching for new product, new procedures, buying a new device, big money on marketing campaigns. But it seems like there's a lot of still gaps in fundamental stuff like your consultation, financial literacy, all these things that really underpin any successful business. Whether it's in aesthetics or anything else, your relationship with your customers, how do you improve that, your comm skills. How are you guys supporting your businesses outside of just clinical education and sort of governance and from that perspective?
Yeah, and I echo your thoughts, David, and of course you're on the money when it comes to that stuff.
No pun intended.
You're on the money. Yeah. In an environment such as this, loyalty counts, and you've got to build that loyalty through delivering great care and being your best self and all of those things that you advocate strongly, and then being disciplined with your bottom line, right? And so would you rush out and spray a undifferentiated marketing campaign right now? That might not be the wisest thing you could do. Would you go out and rush out and get an expensive machine that you then got to service and so on? That probably wouldn't be what you do. We run a lot of business stuff internally for our network, and we have Megan Reid.
Yeah, she's great.
Megs is great. She's done a lot of work through major clinics and now works through us and advocates very strongly for members inside Fresh Clinics as well. So she sort of plays that advocacy role. But we also then do, there's marketing training, and we partner with Basic Bananas and so on. So there's a lot that we like to provide to members to help them become better versions of themselves and be able to deliver better outcomes for their own small business. It still is, of course, we don't run a franchise. We're not here driving small businesses to do certain things. So the buffet is available, but is up to the individual member as to what they want to participate in.
Sure.
Yeah. So that brings us to Fresh Health. What is it, I guess, first of all? How would you describe it? What does it cater for that clinics aren't currently doing?
Yeah, so it's, in a nutshell, it enables cosmetic clinics to provide other medical services through their space, and we're describing it as hybrid healthcare. I don't presume that we invented the term, but it describes to me the difference between completely in-person care. And so, like, I'll use an example, right? So perimenopause care is women's health. It's a big deal for our cohort, for our network. 90% female, the patients who come in, 90% female. And so when we say, well, what if that patient coming in could also get a consultation with a women's health specialist? Would that be something that patient might be interested in? Pretty universally, the answer is yes.
Yeah.
And the difference with hybrid health and what we're proposing is, and what we're delivering, is that patient who wishes to get care for their perimenopause, let's say, they could go to an in-person delivery option, which might be their GP, or it might be a women's health specialist with a clinic or so on, right? They can choose to do that, of course, and we'd encourage that. There's also a choice to get a fully online, telehealth only service delivery, and those options exist out there, right? You can Google them, they're around, you can get that delivered to you. Some people might be uncomfortable with that. In the middle, what we're proposing is you as a healthcare consumer, not you guys because you don't have ovaries and a uterus, but you as a healthcare consumer could go to a place that you go to already, that you're familiar with already. That
for your injectables.
For your injectables, right? That you have a comfortable, long-lasting relationship with a healthcare practitioner that you trust. And so many nurses tell us that they're part-time injector, part-time counsellor, right? The intimacy that is shared in that chair and in that room is real. And that is something not to be ignored in the context of healthcare. Like, how rare is that you have a healthcare practitioner that you have that relationship with? And when we're talking about things like women's health, those conversations are intimate and sensitive. And sometimes it's not, the patient might, and we have this reported to us, that they might feel uncomfortable having those sort of conversations in a quote unquote traditional kind of illness medicine environment where, potentially they don't get the time that they need, they don't have the rapport that they need, and so on. And likewise, pure telehealth doesn't match that need, doesn't meet that need. Well, here it is right in front of us. You can have that conversation, a sensitive conversation about your appearance, sure, but also deeper than the skin. What about your hormone health? What about your weight? What about hair rejuvenation and certain other things that will come around longevity medicine? The scope of women's health includes, polycystic ovarian syndrome and so on. So where we can deliver that care in a hybrid fashion where the patient is looked after in person in a real-world location by a healthcare practitioner, and then is also connected to a healthcare expert, a doctor that specialises in that space, in a telehealth consultation at the same time that they're being seen by this practitioner that they have an enduring relationship with. That for us is a really great marriage of the safety of in-person care, the convenience of telehealth care, having a place to go back to if you've got a problem. Like, all of that marries up nicely. And to boot, it's a great business decision. And it helps those businesses to provide more services to the patients, give more reasons for them to come back, have a stickier, more enduring, more encompassing, more holistic relationship with them. And we've seen that prove out in the data. So clinics that are with Fresh Health, on average, are doing more injectables business than clinics that are not. And, we don't know correlation and causation yet, but we are seeing that as a trend. In those that embrace and go with it are seeing more stickiness to their patients, more repeat visits and more frequency. They've got more reason to come back and more satisfaction. You're delivering a more holistic care.
Yeah. Hey guys, sorry to interrupt your podcast. Just a very quick reminder about our app, IA Community. It's available to download for free. We've got hundreds of practitioners already signed up, enjoying themselves and sharing great information. We've got an offer for you guys. So David, what's our offer?
As Jake said, there's all information below in our show notes, and one of those is a link to enjoy a 30-day free trial to our subscription tier, which gives you access to all of the cool features such as live chat rooms, a clinical library, places to network, elevate your business and clinical education, and much more.
Yeah, so check it out, guys. Try before you buy, and let's get back to the podcast.
Well, there's a lot to unpack there. Let's start with the last point in terms of stickiness. I talk to clients every day around, how can they diversify their practice? How do they kind of continue to evolve as practitioners and business owners? I think it's obvious, the more that people rely on you, you're not just the person treating the wrinkles anymore, they're the person that you're coming to for your hormones. So not only are you going to get a greater level of retention because you become, in inverted commas, a much more important person in this patient's life because you're taking care of more than just one thing. Obviously, it opens you up to a whole new category of patients that perhaps wouldn't have entered into the aesthetics marketplace directly. They've seen the headlines, they've seen the horror stories, they're worried about injectables, it's not for them. but they found you through the healthcare pathway. All of a sudden they establish a relationship. Maybe tox isn't that scary anymore. Maybe I've got a relationship with this person now. Maybe I'm going to try it. So I think you're absolutely right. I mean, I think it's a no-brainer that that was going to happen. And I think that anyone listening to this needs to think about, how do I become more than just my competitor next door? How can I be more to my patients? How can I become a more pivotal part of that patient's life? And then you're talking about, the GPs. And I think the relationship with GPs has changed a lot. I mean, the last time I went to a GP, it felt like they couldn't wait to get me out of the room because I had 50 patients waiting to see in their waiting room. So I feel the relationship with GPs isn't what it used to. It's in, out, what do you need? Here's a script, get lost. That's what it kind of feels like to me. Whereas, you're sitting with an injector, and I kind of use this term tongue in cheek, and I, again, don't mean to denigrate our injectors. I feel like we're glorified hairdressers in some respect. The relationship that a woman will have with her hairdresser, if it's a good one, is unlike anything I've ever seen before. People will drive to the other side of a city, they'll spend ridiculous money because it's the relationship. They have that time, counsellor telling them all their deepest, darkest secrets about things that are going on in their personal life. So I see there's so many ways in which this just becomes an obvious path forward for the industry. What do you think about that?
Yeah, I mean, so to the GPs stuff, so just to be clear, and I want to be really, really unequivocal about this, is we have a huge amount of respect for GPs.
Totally.
And they should be first order call for anyone who's interested in managing the healthcare. And, again, a massive amount of respect and support for the work that they do. The comment around, or the commentary around, do people feel comfortable in those environments, in that illness environment? If you look like historically around where medicine was 25 years ago, it still was a lot of they were the ones who had the knowledge. It's almost like the high priests of old, right? They're the ones who have the books with all the arcane language in it that only they can understand, and you have to go to them to get that information.
Yeah.
I'm sick, please heal me, physician. Yeah. That illness side of medicine still works and is vital, and obviously is core to the functioning of our society, and has full-throated support from everyone in this room, I know. But 25 years since, what we've had is an evolution or revolution in information democracy. And, podcasts like these and others, internet, but also then AI, all the various sources that we now consume healthcare information from, some good, some bad, right? I'm not meaning to say everything's the same, but if my wife, for instance, if she is feeling concerned about menopause or perimenopause because of conversations she's been having with her friends, she can listen to a podcast from a world expert in the matter, and it'll be delivered in a way that is digestible to the layperson, not downplaying on an intelligence level, but just if you haven't had the education in the vocabulary and language of medicine, it's easy to get lost.
Yeah, just like law.
It's like law. Most of those degrees, like large part of it's just language. Like, how do you distill the ideas into the words that everyone understands in the particular profession? But you can have a really intelligent conversation about, menopause, perimenopause, in a way that an intelligent person who is not untrained in the space can understand.
Yeah.
Now, when that person, and take my wife for instance, when she then goes into a doctor's consultation and has a conversation about menopause and perimenopause, I was a GP, I would have been at an information disadvantage in that circumstance, because I probably haven't listened to that podcast, right? Because it wasn't a passion area of mine at the time. So that's an inverse of the usual relationship. Now, in that environment, what you've created is actually healthcare demand that didn't exist before. Usually healthcare demand was restricted to, I'm sick, I want to be well. I've been hit by a car, I need emergency support, et cetera, right? All of a sudden, this new category of healthcare has been created that is consumer-led, healthcare demand that is driven by, hey, I want this outcome for myself. And in particular, in some cases, I want this medicine for myself. The various GLP-1 weight loss medications are the example par excellence of people coming in, naming a medication by name. Like, no one names their blood pressure medication by name. No one comes in and says, I want this cholesterol medication. But we're seeing this healthcare demand. And in that demand, in that consumer-driven demand space, people then have consumer-level experience expectations, which is, I want the space to be lovely, and I'm happy to pay. And I want the interaction that I have with my healthcare practitioner to be deep and integrated and not rushed. And again, I'm happy to pay for that because I appreciate this is a demand-driven thing that I'm willing to pay for. So that space, in my view, should be filled by healthcare practitioners. It shouldn't be filled by with respect to others, and I'm not denigrating here, but that in the absence of medical leaders stepping into that healthcare consumer demand driven space, it's being filled by technology professionals, marketing professionals, finance professionals. That's all fine. But in that mix, the healthcare professional, the doctor, the nurse, the mid-level, the physio, the OT, they are labour units that are plugged into a spreadsheet matrix. Mm-hmm. What we think, what we're proposing to instill in with the Fresh Health concept is actually it's healthcare practitioners that should yes, it's commercial. People are coming and they're wanting a consumer experience, and they're bringing money to achieve that. But that should still be delivered by healthcare professionals. Mm. And so the Fresh Health concept is to put technology and services in place to be able to deliver that healthcare really safely with a really great consumer experience and enable people to have that hybrid healthcare model if they wish.
Yeah. Just to clarify on the GPs, it wasn't a criticism of GPs per se, more the system,
yes,
the process, because I think that it's harder and harder to make money. GPs need to see more patients. There's not enough of them.
Yeah.
And so it's what's acute? What do I need to deal with right now? Doesn't feel like it's the environment in many places to have a discussion around aging and hormones, and it just that was my point.
No, absolutely,
yeah.
And I didn't mean to imply that.
Yeah.
And actually, like from my experience as being a GP, and I was a GP for a year, and it wasn't. I'm not claiming to have done it for a lifetime, but GPs are in a tough spot, right? They're having the quote unquote easy business is being stripped from them, always under the guise of let's help the GPs out, right? And like classic examples are like, let's do UTI prescription, diagnosis and prescription at a pharmacy. Again, not having a go at pharmacists, but like this is an example, right?
Yeah.
From the business of running a GP perspective, they're just stripping out all the easy money, and GPs are left with like really complex chronic care and really tough stuff to manage and so on, right? And so, so naturally, like as they're trying to run their business, that puts a pressure on things for throughput and so on. So totally hear what you're saying, Dave.
Yeah, we were just at AAS conference in Perth, and one of the talks was called Medicine 3.0. And Medicine 1.0 is just staying alive, like caveman kind of medicine.
Like
Medicine
BGs.
2.0 is basically primary healthcare. It's curative. You go there with a sore thumb, they give you antibiotics.
Yes.
It's just transactional in a way. And now Medicine 3.0 is preventative. It's lifestyle, it's optimization, it's stopping you getting sick. So that's what you're offering.
So optimization is a term that I'm leaning into, and the reason is I think you can imagine a health baseline that if you go below it, you need illness medicine, you need curative care. But what if you're sitting there and like, I want to get up, I want to feel better, I want to wake up in the morning and feel better, I want to feel better about myself. And
that's me, by the way. I want to feel better about myself.
To the second point you raised, David, about the hairdresser kind of comparison, which is apt, right? But the challenge that's, I think, that sometimes isn't spoken about is sometimes the healthcare practitioners that I speak to, nurses who inject, they've come from potentially high purpose, high meaning jobs where they are delivering really meaningful care, cancer units, cardiac failure units, intensive care, emergency, right? There's something lost when you run a med spa. There's something gained. There's freedom, independence, you're running your own business, and you can have a beautiful relationship with your patients. But the tools up until now that were available for you to care for those patients were just a little bit further along the line than a pair of scissors and a comb. What we're proposing is let's go deeper. You can care for those patients more because you can start facilitating the conversation around whole body health, hormonal health, weight loss, and further streams of care to come. What else can be delivered through these networks? I think we're only just beginning to get a sense of that.
Yeah.
And the three services that you've mentioned, weight loss, hormones or women's health and hair, they are uniquely aesthetic aligned as well.
Yes.
And they're not necessarily things that traditionally trained GPs are fully all over or have empathy for.
Yeah.
So we
kind
of have that skill set.
System's not designed for that, right?
Yeah.
And there are also, I know of GP practices that are dedicating themselves much more to the quote unquote holistic care, which is totally reasonable and super encouraged from my perspective. There's just not enough of them. And one of the sort of pithy things that I've said is, can I say a brand name?
Yeah, go for it.
Is it's easier to get Botox in Mount Isa than it is to get perimenopause care.
Yeah.
Like how messed up is that?
But I would agree with that because I struggle. I talk about this stuff in every consultation, but I'm currently not doing a fresh health type model.
Yeah.
So I can't easily refer women
Correct.
to these people because
Right.
there aren't enough of them.
And, you know, if you're in a consultation and you're treating someone with potentially poor skin integrity, they're looking to increase, they're looking to optimize their appearance. There are certain things you can do with cosmetic injectables and medicines and creams and so on. But maybe their skin has a poor appearance because of hormonal changes. Yeah. Maybe they're not getting enough sleep because they're in perimenopause.
Yeah.
Maybe they've got excess weight that is affecting their ability to exercise and so on and so on. It's so much deeper than can we
have some sculpture.
Can we treat the appropriate dose in the corrugator? Like, it's so much deeper than that. And that remains a relevant, important part of the industry, of course, right? Yeah. But some of the potentially over-treatment that has gone on in the industry has been a symptom of the deeper issue of, like, we just don't have enough tools to help treat people in the way that we want. And so, okay, well, more filler, more tox, like, what else can we do? And the people are still coming in going, I still feel terrible. I still look in the mirror and I feel awful. I'm still unable to exercise, so on and so on. So having that, and us as an industry leaning into, we're healthcare professionals, we can do more. Let's do more.
Yeah.
And I guess that's part of Fresh Health, and our ambition there is, can we lay the infrastructure, the framework for that to happen?
I'd like to talk a little bit about the history of HRT, particularly for women, right? So there was a landmark study that was done that linked, I don't know, it was a correlation, or they said there was a direct cause and effect with HRT linked to breast cancer. You know, my mum was on HRT. She went through menopause very early on in life and was on HRT. Then this scare came out. She was off it. You know, I think that it has impacted her life, not having those hormones in her body for that period of time. A lot of women have gone through decades without proper hormones being replaced in their body. We've now found out that maybe that study wasn't as strong as it should have been. And then we've got, even if you assume that there was an increased link in breast cancer that was hypothetical, well, what about all the real increases in things like, you know, chronic heart disease, stroke, like all these other things that become higher risk when you have those hormones not in your body?
I finished my medical degree in 2014.
Yeah.
And that was still the teaching then.
Yeah.
And so my understanding of HRT was risky, really risky. Risking issues of breast cancer, certainly. And I just caveat that by saying, this is obviously all general advice, and people should seek the advice of their medical professional if they have any specific questions or concerns. But I think that has proven to be one of the most damaging pieces of health. I'm not going to say misinformation, because that's not what it was, but it has been found to be potentially an over-exaggeration and an overreaction, and that the benefits to women of appropriately prescribed HRT, particularly with modern formulations, is such that it should be widely encouraged for people to seek that advice.
Yeah.
And the stunning statistic is that the most commonly prescribed medicine for menopause and perimenopause is
antidepressants. Yeah.
Which don't help.
No, it's a Band-Aid. Yeah.
Well, not even, right? Like, it's a Band-Aid, but it's a Band-Aid put on the wrong place. So you've still got the wound there, and you're wearing a Band-Aid. So I again hesitate to sort of broadly label generic medical advice, but it's a hugely important issue. And then the other, like, bone health and heart health and all those sorts of things. But the other important thing, and this isn't part of Fresh Health, and so I don't claim it is, but then men's hormonal changes are then, that is probably the emerging frontier of common sense practice in that space. And I don't want to veer too much into it, because it is an area that has been a little poisoned by
the gym bros,
by abuse.
Yeah.
And there's no faster way to get your medical license taken from you than by inappropriately prescribing opioids and testosterone.
Yeah.
Appropriately so, and I'm not here to say that that's not the case, but with appropriate guidelines, testing, governance, I think men are also missing out a little.
Yeah, 100%. So I guess our audience will be kind of screaming, going, okay, how does this actually work?
Get to the point, John.
So you've got nurses mainly in their clinic who are traditionally doing injectables.
Yes.
Now they've got 2 or 3 main new services, so weight loss, female menopause type care, and also hair loss.
Yes.
So how are the nurses trained?
Yeah.
And what's the role of the doctor?
Yeah, so great question. And I think the easiest way to understand it is through the traditional divide in medicine between proceduralists and physicians, consultants, right? What's happening in med spas and cosmetic clinics every day is procedural medicine, supervised procedures, right? What this is differently and entirely separate from a procedure is a consultation.
Yeah.
And it's consultative medicine. That may or may not end up in a prescription at the end of it, but where that differs is the nurse doesn't have to perform the task because the procedure needs to be performed by someone in the room, and that's the nurse, and that's the way the industry is modelled at the moment. But where consultative medicine can provide an additional and efficient stream of asset utilisation is that nurse let's say there's a nurse who runs a clinic, right? The owner-operator, common model within our network. That nurse can have a patient come in and that patient can be injected by that nurse with appropriate supervision and so on. But at the same time, that nurse can then hand over, the nurse, we engage in training in the various treatments that are part of Fresh Health, of course. But the nurse doesn't need to be the expert in the room because the expert in the room is then brought in via telehealth.
Yeah.
So the nurse does what nurses are traditionally trained to do, which is they perform their level of history taking. They may do some measurements, some weight, blood pressure, and so on. They build in empathy, rapport, and advocacy for that patient, and then they connect the patient with a suitably qualified physician via telehealth. And that consultation can happen in the same room, or it can happen in a different room. So if you've got a spare room and a spare iPad, suddenly that room is generating revenue for you as that consultation can happen. Consultations in aesthetics for approval of a procedure can be relatively brief, right? There's limited diagnostic uncertainty. The handover can happen and information can be communicated in a really succinct manner, and then provided the physician is happy, that authority can happen pretty quickly.
Yep.
What we're talking about in consultative medicine is different. So the consult's going to take longer. 30 minutes perhaps to get a proper awareness of all of the various history and so on that you need. So that can happen in a separate room, and while that's happening, that nurse can still be treating other patients.
Yeah.
And the integration of the two helps improve that stickiness that we spoke about before. And not only of the two streams, but also with the one patient, the integration of whole of wellness care and aesthetics care. The patient might come back for their tox review and it's time for their follow-up for their perimenopause care, or vice versa. I might come back in for a follow-up for their GLP-1. Let's get some light therapy while you're here. Potentially there's some sagginess that's emerged because of the weight loss. Let's talk about how to correct that. The two integrate really nicely into the business plan.
Yeah. I remember a conversation I had with Dr. Izzy here. So Dr. Izzy works with
course.
you.
Yep.
We've known her for many years. She's great. And we were talking about just the crossover between hormones and, say, aesthetic treatments and the mindset of a patient who, after going on HRT, in terms of their mental state, how they feel about themselves, self-projection, improves greatly. And so in terms of them being happy with their results, the way they feel about themselves, there's, a very nice sort of overlap and sort of almost like these things working as an adjunct to one another. By having your hormones corrected will enhance how you feel about yourself, more satisfied with your aesthetic treatments, just more, feeling more mentally balanced. And I think we don't talk about that.
An entirely artificial divide to say that aesthetic health stops at the skin, stops at the facial muscles, right? It's a whole of body treatment. And as we, as an industry, I think start to understand that more, then the consultation changes. So the nurse-led consultation stops being just an aesthetic review of the face, but it starts being, okay, what's your hormone health? What's your sleep quality like? Let's talk about your weight, because you're in the room and we're having a conversation about your appearance. Are you concerned about your weight? Have you thought about weight loss? Do you want to speak to someone about it? So on and so on, right? That is core to our ongoing success and relevance as an industry that can provide meaningful healthcare outcomes for patients.
So let's take weight as an example. Is the consultation led by the nurse before handing to the doctor? It's essentially a protocolized list of questions. So
yeah, correct.
If the patient asks questions outside of that remit, and obviously the nurse might not have thyroid knowledge or other hormone knowledge, how does that work?
I'd say, and you'd be familiar, Jake, from your time on the hospital, but it's not dissimilar to an outpatient clinic, right? It happens all the time, every day, across Australia, across the world. Some patient will come in, the first person they see is the nurse. Yeah. That's the first workup. Do the history, maybe they'll do a BMI, maybe they'll do a waist measurement, maybe they'll do a blood pressure, so on, right? Yeah. that information gets documented, and then there's a brief handover to the doctor, and then the doctor will have their consultation with the patient.
Yeah.
That is commonplace. That is every day in medicine. The only difference with what we're doing is there's a digital connectivity to it.
Yeah.
Now, contrast that with, again, not to denigrate, these things are going to be, like online only solutions are going to work for some people. They're just going to want the service, they're going to want the convenience. I get it. But how can you truly know what someone's BMI is if you never laid eyes on them? No one's ever laid eyes on them, done a measurement, whatever. And there are mechanisms, and people send in photos of themselves.
Oh, we've all seen that.
With their top off.
They would just stick their tummy out and because they want their GLP-1 and they're not overweight, for example.
But also, what an awful experience to take a photo of yourself and send that into the internet for someone, all of that stuff, right? Which is, to me, and again, that might work for some people, and fill your boots, that's great. And equally, for some people, they might say, I only ever want to see a doctor. I only ever want to go into a specialised clinic and just see a doctor. Okay, that's fine too. Yeah. But for that big middle that says, I've got a local cosmetic clinic that I already go to, or I know where it is, and to your point about maybe we're introducing some new patients to the clinic, it's happening all the time. I tell you, most often, husbands.
Yeah.
The wife's in there and they say, come on, Johnny, you need to lose a bit of weight. Come and talk to the doctor.
Yeah.
I've got a lovely place for you to go. I've got a lovely person for you to speak to. That's actually working all the time.
Yeah. Yeah.
And so for that middle where you're like, I want to go somewhere local that if I have a complication I can go back to, but I still want to speak to a doctor and I want to have that like feeling of confidence of like, I can get the support that I need. And that needs to be integrated with legitimate medicine that isn't, off the back of a truck somewhere, or grey market import from somewhere, like real deal medicine.
Yeah.
That all, like nothing that we're doing, I would argue, is that new or that controversial or that uncommon. It's every day the way medicine's practiced. The only thing that's different is we're injecting a digital telehealth component, again, which is not uncommon. That's everyday medicine now.
Yeah. Have you guys faced any pushback from, GPs or traditional sources of medicine who maybe didn't know exactly what you're offering and look, say you're kind of cutting corners?
I don't think we're big enough or have made enough splash. That's probably going to happen because that's the nature of the attention economy that we live in, right? And every now and then I find myself on LinkedIn and I feel loathing for being on LinkedIn. But like that's the feed is like, criticize this and criticize that. And I would welcome anyone who had inquiry or curiosity or even criticism of our model to just get in touch, give me a call. I'm happy to walk through what we're doing.
Yeah.
I would counter that if there are criticisms of our model. I think that to what I was saying before about this new slice of healthcare demand that needs to be delivered by healthcare professionals, if we as doctors are not stepping into that space and putting in appropriate controls and setting it up in such a way that patients are getting what they are desiring, not in a fait accompli way, like you pay for it, you get it, but like if patients are out there looking for this service, they're going to go and get it.
Yeah.
And so if medicine is medicine is a traditional industry, if we all stick our fingers in our ears and cover our eyes and say, it's not for us, we just deal with the serious stuff, quote unquote, like totally relevant and fine. But if we walk away from this as a slice of healthcare delivery, we're leaving it in the hand. It's not going to be ignored. It's going to be taken up by technology professionals, marketing professionals, finance guys,
founding pharmacies, whoever. Someone's going to
step into it. And then what you'll find is the sort of sometimes when I read newsletters from organizations of doctors and so on, there's a bit of a boohoo mentality about, well, again, this got taken from us and that got taken from us, and well, like step up, like, and then when there is an organization such as ours, and we're not perfect and we can improve, but when there's an organization such as ours that's trying to have a model that is all owned by doctors and governed by doctors, I'd like to see a curious attitude to that, to find out more, rather than the default, well, there's money involved, so let's shut it down. Yeah.
To your point, we've seen what's happening right now with peptides, right? So patients want this stuff. Whether there's a doctor, nurse, or fresh involved doesn't matter. They're getting it from somewhere. And I would way rather a trained professional and a nurse in a hybrid model, if you were ever going to offer peptides, did that than down from Johnny at the gym.
Yeah, so peptides. I was over at a conference in the US recently, and it's like I go into this conference every year, and you get this like bead on the industry because every year there's a new like thing du jour, and last year it was compounded GLP-1s and this year it's peptides. Everyone's talking peptides and everyone's got a stall that says something about peptides and so on. And GLP-1s are a peptide, just to be clear.
Yeah.
But the sort of peptides that we're talking about are the ones that in Australia are not available for human use and are very tightly controlled. Yet somehow people are getting them and people are using them, and there is this. And just again, to be clear and totally unequivocal, we do not support peptide use in Fresh Health in Australia, and we don't advocate for their use, and certainly we abide by all of the relevant guidelines. The challenge with the peptides and their use in Australia is in the absence of doctors facilitating it, most of the information is coming from unqualified social media sources and so on, and people are just having a go. What are they injecting and who knows, and all that sort of stuff is still very uncertain. It's a much bigger industry in the US where the regulation is, let's say, more open to it. And businesses are starting up all the time. Again, in this AI kind of environment that we're in, you can spin up a website and a drop shipping environment pretty quickly, and that's happening like all the time. And so how does the medical industry, how does the medical fraternity, for want of a better word, govern that, manage that?
Well, you can't. I mean, I was, again, doing a sort of recent series of education workshops, and Mike Clegg was with me. And just to sort of, change direction for a moment, him and Professor Greg Goodman dealt with a very serious case of botulism. It was from someone who wasn't a doctor or a nurse who bought this stuff called Lizotox or something from the internet. Patient was intubated in hospital, looked like she had a stroke, and there was no repercussions for the person. Like, I know that they contacted the regulators. I don't know whether they could or they didn't want to. There was nothing that happened.
Yeah.
And then there was more cases of this practitioner, or not even practitioner, this person caused more issues.
Well, she then went to New South Wales. Like, I know the case you're talking about.
I mean, it's just...
It's some of the challenges, some of the advocacy that we make when we speak to regulators is that the industry itself, by and large, is populated by high-quality clinicians who are trying to do really good work and abide by the rules. Sometimes the rules are conflicting, but everyone's trying their best.
Yeah.
When what needs to be dealt with with a lot of clarity and intent is that side of things, right? It's black market imports done by unregulated providers in unlicensed facilities. Some of the challenge that we see is that when those stories emerge, the punitive corrective action is taken on licensed operators using regulated pharmaceuticals in proper clinics, and inevitably it ends up hitting the little guy kind of hard. And that's tough. Some of that it's reality of life. Like, people want to do something, so they do, and they pull the levers they can hold, and so we spend a bit of time in advocacy around that stuff, in education around. We're not the cosmetic cowboys of that Four Corners documentary. That
was my title.
Yeah, it was. That's right.
Don't steal my thunder, John.
Sorry, TM.
Yeah.
That's some of our advocacy. Right?
Yeah.
So from a business perspective, how does this work? Does the patient pay for a consult? Is it a subscription?
Yeah,
so paying a doctor separately.
Yeah, so the details. I mean, the details of it are there's a pay-as-you-go option. We're a B2B supplier, right? So we supply to those clinics consultations, and the doctor is paid by the business. There's kind of accounting detail to that, but at a very broad level, the clinic will receive an invoice from Fresh Clinics for the use of consultative services. So let's say, for instance, a weight loss consult. The doctor for that is paid a certain amount, and then over and above that is what the clinic then charges the patient. So it's a cost of goods. Okay. The clinic then charges a margin on top of that according to their socioeconomics and business goals and so on. But generally speaking, it's about a 2x on what gets charged, and that covers the facility and the nurse time and so on. The charge for a weight loss consult is different from a women's health consult because there's different time and different specialties and so on. Women's health consults are accessed on a subscription-only service. It's been a lot for us to set this up, and there's ongoing value that the clinics can derive, and so we need to make sure that we're covering what we need to cover to keep the system going. So there's a subscription that's required to access the women's health services. We're finding that subscription in most clinics is repaid after 2 consults. So it's like it becomes, although people may initially balk at that, it becomes a little bit lay down misere, like a bit of a no-brainer once you see the economics stack up.
Yeah.
And not only is there the economic impact of adding these additional revenue streams to your business, there's all the indirects of like increased patient retention, increased patient frequency, increased advertising channels that you can approach. So no longer is it just see me about cosmetic for a cosmetic consultation. It's see me about women's health, see me about weight loss consultations. It opens up a whole gamut of new patients and new acquisition channels for you.
Yeah. Because, sorry, go on.
I was just going to say, and from the patient's perspective, they've been plugged in with the doctor for this consult. If they need a script, presumably they'll hormones or something.
Yes.
Is that like an interaction between the patient and the doctor, or is the nurse involved in that?
No, patient and doctor. So the typically what happens then is the script will be sent to your phone, and you can go and collect it from your pharmacy of choice.
Okay.
There is a time in the future when we'll start facilitating that medicine to be sent to your home.
Yeah.
And
Fresh drones.
Yeah, drones that's right. That's I've got one of those big T-shirt guns that they have at the basketball, and I'll just start
we'll
shooting
sponsor them with our stickers on, don't we?
Yeah. But that's like we're interested in the hybrid model of best in-class care, but also leaning into the convenience that people want and the consumer experience that people want. Like that can't be ignored. These drugs are expensive, and if medically appropriate and people are prescribed them, it is an impact on people's budget, and so people want to feel serviced. And in today's economy, like I want stuff to deliver to my home, and I want packaging to be nice, and I want when my follow up, I want that to be good, and the digital experience is good, all that sort of stuff, right?
Yeah,
that's all stuff that we're investing in.
Yeah, some of the pushback I've had from clients of mine that are thinking about integrating this kind of service into their business as well. I don't make the same sort of money per hour that I would out of doing a filler or an injectable.
Yep.
And my message to them, and I'll be curious for your comments, is we need to think about this big picture. These are a whole new class of patients potentially that you would never have had access to before, or these patients that used to be yours are now going somewhere else because they can get everything done in one place. And it's not just about how much per hour. It should always be, well, what can I do to be the best provider I can for my patient? Plus, there's all these other advantages, which is new flow, more retention.
And what's the product mix,
Yeah.
right? And like that, show me the person who's booked wall to wall 5 days a week,
Yeah,
right? Like,
not many.
Like it's you've got gaps in your calendar. Like why wouldn't you? I would advocate that it seems like a reasonable idea to try and fill those gaps.
Yeah.
And it's not, you look at any successful business, they're not offering one thing. They're offering multiple ways to attract more of that customer's wallet, that patient's wallet.
Yeah.
And if we're talking perimenopause, menopause, weight loss, the Venn diagram overlap on patients of a med spa, patients of cosmetic clinic, and patients who may be medically appropriate for those treatments is pretty close, right?
Yeah.
So what that means is if you've got a patient in the chair and you're only offering them toxin filler, they're going somewhere else to get their menopause treatment. They're going somewhere else to get their GLP-1. Why don't you get that wallet share, right? Why walk away from that? Some of the objection we have from some people is they're like, oh, it all seems too hard. I'm like, running a business is kind of hard. This offers you another avenue to retain patients, to increase the depth of relationship they have with you, the loyalty they have with you, and again, the data that we see is the clinics, the nurses who kind of get this tend to be doing better over the time. We've had this in market for 6-12 months or so. I can't remember the exact time. But as we track that, you can see a divergence in patient retention, in patient spend, average patient spend per appointment and so on.
Yeah. I mean, I would think the governments and the public health service would be right behind this, because if we can get to our patients before they get ill, if we can stop them becoming morbidly obese and, getting multiple comorbidities and ending up in the emergency room, why would they not be all for this? I mean, we've already got a strained public health system. If
Just take the pressure off the GPs and primary healthcare, and maybe even tertiary healthcare.
Yeah, well, I mean, the advocacy that cuts through, and you say GLP-1s in regulatory meetings and everyone rolls their eyes, but women's health cuts through. Yeah. And it shouldn't be easier to get Botox in Mount Isa than it is to get perimenopause care. We've got a distributed network of clinics that can provide services into rural and regional Australia that are otherwise kind of hard to get. Like you get are you going to get an endocrinologist or an OBGYN coming into your remote town once every so on? Like it's not happening.
Yeah.
So here's this like what has been surprising is that some of the, I'm not going to call it the like solution to rural and regional access, but a part of the solution has been driven by aesthetics. People don't like that, but it's because there's commerciality there. So it makes sense. I'm a nurse. I can start up a clinic in Ballarat and I can start servicing patients. What I've actually done is create a healthcare location.
Yeah.
So what else can be delivered through there?
Yeah. Exactly. Yeah, it's always interesting when people sort of, you said roll their eyes at GLP-1s. It's like, okay, well, what's the largest risk factor for every chronic disease that we know? It's being overweight. I mean, when you've got teenagers now being diagnosed pre-diabetic. I mean, it's an epidemic. So why are people rolling their eyes? I don't understand.
Yeah, I think it's the there is a inherent prejudice that exists around commerciality in medicine that I'm fine with that. Like, you've got to be very careful around it. It exists in, like, there's obvious commerciality in a lot of medicine that is underappreciated. This is very overt. It's very commerce and medicine interacting in this clinical space. I think that the GLP-1 stuff, some of the challenge is in the absence of a good consumer patient-centric model that doctors have proposed, patients are just flooding to models that have been set up by marketing, tech, and finance people. Yeah. And that's where everyone's rolling their eyes, because the good governance doesn't come. Good medical governance isn't then bred into the DNA of those organizations. It usually comes later when there's issues and so on. And again, I'm not pointing out anyone specifically, but it adheres to first principles that if the foundation of your business is, how can I make a profit out of this? How can I drive a return for shareholders out of this? As opposed to, John and I are doctors, and that medical governance is baked into what we do from day one, from our DNA. How can we set this up so patients are safe and we can deliver a really great patient experience? That's kind of a fundamental difference, I think.
Yeah. Can you share what you might introduce in the future? Or is that all secret?
No, I mean, it's not. Like, longevity's a thing for us. The challenge with longevity in Australia is there's not too much you can do in the absence of peptides and other things like that becoming approved, available, legal, so on. Yeah. And so you can do a wide variety of testing. There's certain compounded medications that might be appropriate depending on the results of those testing. And so that's attractive. People like, again, health optimization. What can I do about getting better through a longevity focus? I think deepening the suite of offerings for women's health is really important. PCOS, which it was called in my day, I think they've changed it to POS or something. The acronym's changed. I don't know if you're up to date with that.
Polycystic ovarian syndrome.
Yeah, so the acronym's now changed.
Oh, well, no, yeah. I'm ancient like you. So ancient. Yeah,
that's a focus for us as well. Contraception, getting the pill. Can you have a good conversation with a sympathetic healthcare provider who is female? Yeah. And, when I was prescribing the pill, I am happy to acknowledge my I wouldn't call it ignorance, but my lack of appreciation of subtlety and getting the right medicine for the right patient wasn't something that I had a deep amount of training in. And that influence, that has a big impact on people, right? So should we be looking at ways that we can optimize that younger women in particular can get access to PCOS treatment, to OCP treatment, that's oral contraceptive pill? I think we should, and I think this is a mechanism to do that.
Yeah.
Yeah. So what does the next 12 to 18 months look like? What's sort of the short-term goals? What are the challenges you need to overcome?
I mean, there's always stuff every day. There's the day-to-day challenges, but the long-term arc of this thing is we feel, again, relentlessly focused on members and member value. If we do our job right, what we will continue to build is a platform that people can build their own businesses on. Yeah. And that's our view, right? Is like I think we've succeeded in some ways because we have enabled those nurses and those business owners to drive their own positive outcomes and haven't been telling them what to do, quote unquote, but just facilitating a platform on which they can build their own business. That's going to continue to be a big focus for us. And US continues to grow and expand. And for us, that is really exciting for us, and we want to continue to service that market really well.
So for audience listening who may not be a fresh nurse yet and they're kind of like, wow, I didn't know that you guys did this. How easy would it be to come into your sphere and learn and train and get that support? What does it look like?
So to access Fresh Health, you've got to be a fresh member. Mm-hmm. So you've got to be using us for your medical infrastructure support. And so that in itself, there's a compliance set up. But, generally speaking, it's easy. It's free to become a fresh member. We don't charge a monthly subscription fee, and you can leave us at any time. We we instead have the philosophy that, like, if you want to leave us, it's because we're not doing our job well enough, and we need to get better. And so we're continuously focused on that rather than lock in contracts and stuff like that. We don't do business that way. So once you're a Fresh member, then the integration of Fresh Health into your business becomes quite natural. It's integrated into the technology, being more integrated as we go, and the provision of those sort of services comes after a little bit of training. But again, the nurse, as opposed to the procedural stuff where the nurse is and has to be the expert, that's not the case here. There is a degree of knowledge that people have, and that's appropriate, and also we're finding the nurses really want to be knowledgeable in that space, and that's great. And so we do provide that training, but it's the doctor who then brings that expertise, the prescribing credentials, and so on. So that then becomes quite natural. So we have, I'm sure we'll put some links on this pod, but if you want to find out more, there's the website to go to. There's, we've got our phone number that you can call up. It's Insta and the various socials is also another trend to follow. And we'll ensure that we get some accurate information up on the Inside Aesthetics app.
Yeah, of course.
Absolutely.
And what about doctors? Yeah. What if I want to upskill?
Oh, of course. So that's obviously a huge opportunity for us that we see continuing to emerge. And I think there is a reputation that we have that we're only for nurses, and I'd like to dispel that. Like we work really collaboratively with any doctors who also want to participate in our network, both as a scripting doctor, as a prescriber, but also as a user of services. And for this, to your point, Jake, if you're treating patients and think it would be great if I could get this patient set up with a women's health consultation, set up with a GLP-1, that's the sort of thing we can facilitate. So again, details to connect will be on the pod, but I'd encourage anyone to reach out. What we've done is we've invested every dollar that we've ever had into the people and the technology to enable these sort of things to happen. And so our promise back to our doctor colleagues is you can leverage the scale that we've built to enable you to grow your own practice.
Yeah,
great.
Okay. And before we let you go, what's happening? There's something called Fresh Summit happening around the country. Tell us a little bit about that.
Fresh Summit's really exciting. The Fresh Life has been our flagship landmark event that we've had for the last, I think we've run it for 4 years.
Yeah. But
we got to the end of last year and we thought to ourselves that there seemed to be a bit of conference fatigue in the industry. Yes. And that was from both participants, but also from pharma and speakers and so on, right? And what we knew about the industry and what we knew about our network is training is still in high demand and favoured. And so we thought to ourselves, Fresh Life it will come back in some way in the future. But we thought to ourselves, this year, let's change it up, right? And so what we've done is it's called the Fresh Summit, and it's a focused on training, and we've got really high quality training provided, including some cadaver workshops that are add-ons. But the training is dedicated. It's over 2 days. There's some events and some speaking involved in it. I think Sydney and Melbourne are sold out. Might be still some tickets available for the Tweed Heads, which is the Queensland function, but we're not in Queensland specifically for reasons discussed previously on this pod, and Perth as well. So we've got, there are, I believe, still tickets to Perth and Queensland, but it'll be fantastic. Again, it's a celebration of the expertise of our industry and of the ongoing mastery that the industry continues to invest in, and we're happy to be part of that, facilitate it, to help our pharmaceutical partners to present their best cases in these particular environments. So, it's really exciting. We're looking forward to it, and we've put a lot of work into it. So we hope people enjoy it.
Awesome. Fantastic. Well, thank you for joining us again. Thank you for coming. And look forward to learning more about Fresh Health.
Thank you. Thanks for inviting me. Appreciate it.
Pleasure.
Thanks, John.
Hey guys, we hope you enjoyed that episode. Now, to keep the conversation going, download our free app, IA Community, and let us know what you liked, learnt, or even disagreed with by commenting on the podcast in our IA podcast library.
In IA Community, you can connect with hundreds of other industry professionals, get access to business and clinical education, as well as networking with our growing list of industry partners and much more.
Please leave us a review on Apple Podcasts, Spotify, or YouTube. It really does help us grow. And also share this episode with a colleague who'd benefit from it too.
To stay connected with us, you can follow us on Instagram, TikTok, or LinkedIn for our latest news and updates. All of our links and contact information are in the show notes below, and we look forward to seeing you in the next episode.